So hopefully everybody can see this. Hopefully everybody can. So I just want to extend a big warm welcome to everybody this evening. Thank you all for joining me. Thank you for all giving me 45 minutes to an hour of your time this evening. I know people are a little bit zoomed out, but hopefully, you know, you're going to enjoy this webinar. You're going to learn something new, learn about a new product, which is an amazing product, and enjoy the webinar this evening. So grab yourself either a cup of tea, water if you like me, if you're on dry January, or if you're not on dry January, get yourself a glass of wine and sit back and enjoy the presentation. So I am just going to stop the video and focus solely on the presentation. Okay then, so my name is Sarah Whitehead. This webinar is taking place under Shop Beautiful. I'm one of the brand ambassadors for Shop Beautiful. We've got lots of different products, exclusive products in our website, on our shop. So if you visit shopbeautiful.co.uk, you can see the plethora of products, treatments and consumables that you might like to order in the future when hopefully, fingers crossed, things get back down to normal. Oh, gone back to this now. Well, why have we stopped sharing the screen? Okay, let's go back to it. Okay, there's always some kind of technical error on this, I tell you. Why is it telling me? Oh, okay. Let me go back all through this. So you're getting all the preview before we've even started. It started right at the end, which is frustrating. But here we go. Okay, so my name is Sarah Whitehead. I'm a registered general nurse. I'm an experienced aesthetic practitioner. I've been in the industry 16 years this year, and I've had my nursing pin for 21 years in March, which is quite scary. It makes me sound really old. But I've been around for a long time in aesthetics, and I've worked for lots of different companies. I started off working for skin. I've worked at Harley Medical Group. I've worked in a private laser clinic. I've worked as a training manager for Cynosure lasers. I've worked as a training manager at BTL Aesthetics with the Exelis. I was one of the first nurses in the whole of the UK to have the Exelis machine about, I think it was like 2013 now. And I've also worked with Lorna Bowes Aesthetic Source. And I know the Exuviance range is on the Shop Beautiful webinar website as well, if you're interested in any skincare. So obviously we're talking about BioRePeel tonight, and we can't talk about the BioRePeel without introducing our founders. This is Carlo and Andrea. They are two young Italian biochemists who have researched and developed the BioRePeel. And the BioRePeel is minimal prep, minimal pain, minimal downtime, but with maximum results. And I love this little computer because I've got a new little pen and I can use it to show you where it originated, and it's in our little boot area in Italy. So it was produced in Italy in 2018 in January, and I've been involved with the product since October 2018, and it's a peel that is absolutely amazing. And in just 2 years, as you can see, we are now selling BioRePeel in over 52 countries, and obviously the countries in green is where we distribute the product, and it is sold, so you can see where it is. And we've got open negotiations with Brazil, Australia, the southern tip of South Africa, and Asia. So it really is sort of taking literally the world by storm. So as aesthetic practitioners, it's really important that we understand what a patient is hoping to achieve from their skin peel and chemical peel, and that we're able to inform them of all the options available. So obviously we've got 3 depths of peels. We've got superficial depth peels, and these are often known as the lunchtime peel because they're so superficial. There's very, very rarely any downtime as a result of the treatment, because all we're doing is removing the outer layers of the epidermis. So they're a great introduction to skin peels, and particularly great for patients who are new to aesthetics and are quite nervous. You know, when you start talking about chemical peels to people, they're always like, oh my God, is my skin going to burn off? And you're like, no, there's so many different peels on the market. So superficial peels are usually great for sort of the patients that are new to the aesthetic industry. Then we have our medium depth peels. These remove cells from the epidermis and the mid-dermis level, and they usually require 2 weeks prep of the skin. And you'll find that TCA is one of the most common ingredients used in a medium depth peel. So you have different strengths and combinations of trichloroacetic acid, can be used dependent on skin types and the results that are desired. They're usually, I wouldn't say painful, but they're quite hot. They feel the skin is burning, the skin looks red and feels quite sunburnt afterwards. And the Downtime, obviously there's a very famous peel out there that turns your skin blue and makes you look like a little Smurf for up to 72 hours. And it takes about 10 days for complete healing of the skin. Not everybody wants to look like a Smurf, even though the results are great. A lot of people don't want that Downtime, although you might find in lockdown, people don't really care because they're not really going anywhere. And you can sort of, you know, you can put a nice filter on if you've got any peeling skin, if you are on a Zoom call. But these aren't suitable for darker skin types. Things like the Jessner peel is a better option. And then we have our deep chemical peels. So these are a lot more aggressive. The peel penetrates right in to reach the reticular dermis. Phenol is the most common ingredient used in deep peels, and most people would require a local anaesthetic before the procedure because they're really painful and really uncomfortable. And it takes probably up to 3 months for the skin to recover. They'll need lifelong SPF and they need to keep their face out of the sun. The effects will last for probably about 10 years, and you will need to go and see a doctor usually if you need this kind of peel, and they're not suitable for darker skin types. So what are the benefits of chemical peels? So chemical peels can improve loads of skin issues. So if we look at the most common, one that, you know, chemical peels may help treat, we can lighten unwanted pigment, we can even out skin tone, we can diminish fine lines and wrinkles. And I'd say fine lines because, you know, if you've got deeper lines and wrinkles and you've got somebody who comes in and they look a bit like a leather handbag, unfortunately these kind of peels are not going to improve. You know, you're not going to go from a leather handbag to a crocodile handbag just from one peel, unless you have a really deep peel. But we can brighten out and smooth rough skin. We can increase production of collagen and elastin so the skin looks firmer and plumper and tighter. We can lighten acne blemishes and prevent any future acne outbreaks. So obviously I'm here to talk to you about the BioRePeel this evening. It's a lightening, tightening, brightening 35% TCA peel. And like I said, I've been working with this peel for over 2 years now, and it is literally the only peel that I use. And you'll find a lot of people who start using the BioRePeel and they start seeing the results, and the patients and the clients start seeing the results. Everyone's like, this is the only peel that we need. So we've got one concept. So I'm going to come back on the screen actually and just show you my BioRePeel. Let me just get it out. Okay. So hopefully we can go on the video. So hopefully you'll be able to see this. So this is a beautiful, pretty little peel. So it is one concept. So this is just the concept in the middle. It's safe, it's effective. We don't need any needles to apply it to the skin. It's patented, and the patent is for till 2035. It has an immediate effect on the skin, which improves over time, and it's a multi-action as well, and it can be used on, obviously the FND gives it away, so face, neck and décolletage, and it's literally, that is 6 ml. I'm going to go through this a little bit later, but there's 6 ml in a vial. Okay. So the phases, as you've seen on the video when I just came on, we've got 2 layers to this peel, and we have our lipophilic phase, which is a fatty, oily substance. So obviously fat floats, and it's a barrier that protects all of the active ingredients from oxidizing. It has a filming action on the skin, so it protects the hydrolipidic film. So this is the protective barrier, if you like, that covers the skin, and basically makes sure that the skin maintains its suppleness and moisture. And it also what ensures that the peel is minimally discomfort. So it allows for penetration of the active ingredients into the skin as well. Then we have our yellow layer. See, I can say that because I've had a dry January, so I can say that really easily today as well. That's really good. So this is our hydrophilic phase, and this contains this powerful mix and innovative ingredients of trichloroacetic acid, alpha hydroxy acid, our beta hydroxy acids, our polyhydroxy acids, our amino acids, and our vitamins. And basically we're able to perform a deep biostimulating and revitalizing moisturizing effect on the skin. So obviously the peel is providing nourishment in the form of all these amazing ingredients. So, you know, we've got a real powerhouse and in such a tiny little amount here as well, which is really exciting. So why is the biphasic technology in BioRePeel so important? So now, like I said, I've been in the industry for 16 years this year. And when I first started with chemical peels, I used something called MD formulations. So, and there was other various TCA peels on the market. And anybody who has experience in TCA peels knows that in the early days, there was loads of negative issues concerning the product. So basically, TCA would be unstable. If you didn't look after it and pander to it and protect it and put it in the fridge, it would darken and then it'd oxidize and denature. So literally the peel would become null and void. So anybody who left it out of the fridge used to get into trouble. So how does the biphasic technology work? So basically, let's just go on to our little, I'll show you. So we've got our blue layer, which is our lipophilic layer. So this barrier floats on top, as you can see, of the yellow layer, and this prevents the contact with the oxygen inside the bottle. And the mechanic barrier stabilizes the hydrophilic phase and the TCA and the other active ingredients so they don't oxidize. And the density difference of the two phases guarantees a constant protection even after shaking. So basically what this means, when we mix this peel, we have to shake it to wake it. So I get another bottle. So all we do is we shake it to wake it. This is to activate the peel, and it goes, as you can see, the colours mix together and we get this sort of Pseudomonas phlegmy greeny colour. It's quite a potent greeny colour. But after a couple of minutes, literally, this product goes back to the two layers, but the density difference is still the same. So it guarantees this constant protection. So it makes the peel really safe and doesn't affect the product's what's the word I'm looking for? Oh, I can't think what the word I'm looking for now. My mind's gone blank, but it just makes the performance of the peel. That's the word I'm looking for. Okay. So the advantages, we can store it at room temperature. It hasn't got to be put in a fridge. We don't get any oxidizing of the product, so this guarantees maximum safety and efficacy of the product. It doesn't darken or degrade. Once opened, you've got about 6 weeks to use the product. Okay, so just be aware of that and be mindful of that. But if you're selling it as a package of 3 or 4 peels, you will find that you will go through that bottle really, really quickly, and you probably won't have any in the cupboard after 6 weeks. So we've got 4 functional complexes of the peel. Bio stands for biostimulation, and basically it's going to stimulate fibroblast activity. It's going to activate cutaneous proliferation. It's going to plump the skin and protect against free radicals. And we're going to do this because we've got glycine, proline, hydroxyproline and vitamin C. Then we have our revitalization of the peel. It creates an anti-wrinkling effect, tightens the skin and encourages the skin to look more fresher, radiant, healthy and glowy. Then we have the peel. So obviously we've got our trichloroacetic acid, we have our Lactobionic acid, our Salicylic acid, our Tartaric acid and our Citric acid. So basically this is going to remove the cells of the stratum corneum by melting the corneocytes adhesion bond. So basically we're just going to get rid of all that dead skin cells that's glued to the surface of the skin. It's going to melt them away and reveal healthier, less congested skin. We're going to unblock pores, reduce sebum production and reduce outbreaks. Then we have the lipo complex. This enhances the penetration of active ingredients. It moisturizes and hydrates the skin. So when the peel's removed, it gives it a really silky texture. And I can't, until you try this peel, and I always would recommend that you buy this first and try it on yourself before you do it on any patient. It's just so you know for your own experience how, what it feels like when you've applied it to the skin, what it feels like when you've taken it off, what it's like after a few days, what it's like a week afterwards. But literally, when you remove this peel, your skin feels like velvet. And this is because we've got squalene. So this mimics your skin's natural oils, making it an excellent emollient. And it's really well suited to moisturize oily and acne prone skin because it's lightweight, so it won't clog your pores, and it's safe for all skin types. And then we've got our isopropyl myrostate, which strengthens the skin natural moisture barrier. And this locks in hydration. It enhances the penetration of other ingredients to the skin. And like I said, once removed with water as well, we don't neutralize this peel, your skin literally feels so soft and so smooth, and it looks amazing. Have I sold it to you yet? It is fantastic. It's something that I use on a regular basis. So we're just going to go just a little bit in depth to some ingredients. So obviously the skin is our largest organ and probably the least looked after, although I'd like to think in lockdown, people have started to prioritise and they've got more time on their hands to sort of think, right, I'm going to put myself first. I'm going to look after my skin for the first time in ages. And this is great for, you know, you can be building this up for when we get back out of lockdown. You can be talking about this as a product that you're using yourself. You can even do a little blog, a little diary of you using the peel and saying how excited you are to be bringing this to the salon where you work. So obviously the BioRePeel contains amino acids. These are our essential building blocks in every cell. So glycine is the most abundant amino acid in collagen, in about 35%. It has moisturizing, antioxidant and regenerating properties, and it's also one of the amino acids that the body uses to make glutathione. So this is one of the most powerful antioxidants that helps to protect your cells from free radical damage. Then we have proline. This is a basic amino acid in collagen production and support. It has elasticizing properties, so it's great for an elastic and aged skin. So anybody who's got little, you know, just needs a little bit more tone and firmness and turgor to the skin. It also assists with elastin formation, so it helps to deliver hydration to elastin fibers, which are hydrophobic. So basically, this ensures that your elastin fibers retain their oomph, and we get that really nice tightening effect when we've removed the peel. Then we have hydroxyproline. This is widely present in collagen. It increases and supports ceramide synthesis. It activates keratinocyte proliferation and fibroblast collagen production, and it helps to form a protective layer that plumps the skin, retains moisture. And then we have our vitamin C. So as we know, I don't know, everyone's going to be doing loads of Zooms or webinars, but our skin cells are under constant stress from free radicals. And this causes damage to cells and leads to premature aging. So we're all going to emerge out of the third or fourth lockdown, whichever one we're on, with all this like damaged skin. But hopefully we're going to save our clients' skin because we've got the BioRePeel. But this basically, you know, leads to dehydration. It damages the cell's DNA, and this can't be repaired. So vitamin C is a really important and useful ingredient, and it's something actually that I take as well every single day because it's obviously important for having a healthy immune system as well. It plays a huge and essential role in collagen production, and it is the main cellular antioxidant molecule that protects from reactive oxygen species, so ROS. These are free radicals which attack skin cell molecules, and these cause cross-linking of collagen and elastin, which obviously give us fine lines and wrinkles, which we don't want. Lockdown's bad enough without lines and wrinkles to deal with as well. But it also regenerates other antioxidant molecules such as vitamin E. So obviously we get to a boosted collagen production, we get firmer, plumper skin, and we get to soak up those free radicals and any UV damage. So it's a great anti-aging ingredient. Then we come to our gamma-aminobutyric acid. So this is also known as GABA for short, which is always easier to say. But this has an effect on the synapse level. So it's a non-essential amino acid, and it's the chief inhibitory neurotransmitter in the central nervous system. So basically it means its function is to reduce the activity of the neurons to which it binds. So this inhibits nerve transmission. So basically, it promotes collagen synthesis thanks to its inhibition of cutaneous MMPs forming. So MMPs, if you don't know, you're going to find out. They are a group of enzymes, and they're activated when there's any UV exposure or inflammation. and they contribute to the breakdown of collagen, and they prevent new collagen from forming. So because of how gamma-aminobutyric acid works on the central nervous system, it has an effect on the cutaneous tissue distension. And this is because the nerves become more relaxed, okay? So all you need to remember, because I know it's a little bit sciencey, so if you're a bit like me and you're not into science massively, but you're a bit more practical and you need to think of things easy in an easier tense, it's basically your nerves become more relaxed. So it initiates this anti-wrinkling action topically, as opposed to in the muscle itself like a toxin. So it acts on the surface topically as a toxin, as opposed to in the muscle, if that makes sense to you. They can be used together and they work beautifully in conjunction with each other. And that's why this peel is so great for anybody who doesn't offer toxin, or has got anybody who doesn't want to have injections, because it is a topical toxin. I'm not going to say that it's going to take the place of toxin anytime soon, because obviously it's not. However, it does tighten the skin, and it does have an effective reaction topically and give you that tightening effect. But for me personally, to get the best results, use them in conjunction with a toxin. It's absolutely amazing. Okay, and you would do this post, you make sure you do your peel pre-toxin. You don't want to be doing it post-toxin, because you need to rub this peel in, and we don't want anybody having droopy eyelids. Okay. So then we come into talk about arginine. This is a basic amino acid, and it has moisturising and trophic functions for the skin, and it's involved in the blood flow regulation process. It helps to regulate biochemical processes like protein and macromolecular synthesis, such as collagen, elastin, and keratin. It's great for an elastic skin. It's involved in blood flow regulation processes, so it encourages healthy skin, promotes cellular growth, and it's a biochemical modulator of trichloroacetic acid, meaning it acts as a buffer to the skin. And it releases nitric acid into the blood, which acts to widen blood vessels. Therefore, we get glowier, healthier, fresher looking skin. So arginine also improves circulation. It promotes angiogenesis and tissue growth production. Fantastic ingredient to use on rosacea. Now, when I say rosacea, I don't mean, acne rosacea or, really excessive rosacea. Somebody with broken capillaries, it works really well with a bit of photo rejuvenation as well, because what we're going to do is we're going to strengthen the blood vessels and encourage new capillary growth. But like I said, to get optimum results, I would personally, if you can, use it in conjunction with something like IPL. But it's also a great ingredient for recent post-acne red scarring as well, a bit of PIH. It's fantastic. It works really well on this. Only time I'd be a bit careful with using this peel, I mean, obviously I'll talk about the contraindications at the end of the presentation, is if you've ever got anybody that presents with a suspicious lesion or any sort of active melanomas in the area, please don't use this, because we don't want to be encouraging an increased blood supply to an active cancer, okay? And if there's any time or any reason you just look at somebody's face and you think, what's that little area here? What, how long have you had this? And find out a little bit more about it. And if you are not confident to treat, do not treat it. If you always feel a little bit, do I treat or not? Don't do it. I like to sleep at night. I tell all my delegates like this on all of my training. If you are not sure, there's no harm in saying, look, I'm not sure what this is, but why don't we refer you to a specialist like a dermatologist, and find out what it is before we carry on with treatment. And you'll find your clients will respect you so much more, for putting the best interest, for, thinking about them first, as opposed to thinking, oh, we've got to do it for the money. If you're really looking after your patients and your clients, they'll thank you for that. Then we come on to our riboflavin. This is also known as vitamin B2. It's a hydrophilic vitamin. It plays an extremely important role in healthy glowing skin, maintains the growth of tissues to ensure health cell turnover for a brighter, more radiant complexion. Riboflavin is essential for the formation of FAD and FMN, and these are both vital for the processes that make energy available for the body, and they also activate other vitamins. And it's important not only for the skin, but also for the nervous system and eye health. So its antioxidant nature can protect the skin against our reactive oxygen species. It can accelerate cell growth and regeneration. And it's a really important vitamin for those prone to spotty sort of acne skin, because it helps to maintain the mucus secretion of the skin, and this helps to prevent any acne breakouts and dry skin. It can help clear up pesky spots and revitalize the skin by promoting healthy skin cell turnover. And if you find that you are a little bit spotty, or you've got a patient or a client that's, I always say patient or client because people refer to them as patients or clients. But if you've got somebody that comes in and they're presenting a bit spotty, they could be actually vitamin B deficient, okay? Because you'll find that people who are vitamin B deficient can be prone to acne breakouts. So in my opinion, it's always worth advising patients to take vitamin B supplement alongside treatments, or if they don't want to do that because it's too costly, just tell them to eat more mushrooms. They can eat almonds and spinach because they're really high in concentrations of vitamin B. So as we know, you are what you eat. So it doesn't hurt, you know, suggesting they add these to their diet. And always, you know, with your patients and clients, just tell them about the importance of drinking lots of water as well to flush out all of those nasty toxins. Hope everybody is still with me. So now we come on to our trichloroacetic acid. So it's such an interesting ingredient, actually, and I don't know whether you know this. I really like random facts. So TCA is a relative to vinegar, believe it or not. So don't go downstairs now and start putting vinegar on your face. You don't want to be doing that. But it's been used in peels for around about 20 years, and it penetrates deeper than glycolic acid. So it's a carboxylic acid with exfoliating action and an indirect revitalized action on the skin. And when it is applied to the skin, it makes epidermal proteins precipitate and denature. And this process is defined as keratocoagulation. So you will also know it as frosting. So it's where you see the skin goes white. Okay. And basically, the level of penetration depends on the substance concentration. So as you can see on our diagram on the right, or it might be on your left, you can see that 35% will penetrate mid to deep dermis level. So this is a deep peel, okay? So, you know, it's still to be respected, okay? And I just wanted to talk about peels of old. So TCA peels of old would usually involve 2 weeks prep prior to the treatment, and then they would come in for their treatment with you, and you'd strip the skin of the surface oils with quite an aggressive prep lotion, and you'd apply your TCA in a specific way. So you'd start on the forehead, then the cheeks, then the chin, and once you'd got to 2 passes, this is the point where your patient is like, this is burning my face off. This is really hot. So you're there with your clipboard and you're fanning it. Or if you're in a really nice clinic, you're there with your handheld fan and you're looking out for this frosting. You're looking out for this keratocoagulation. You're looking out for this whiteness of the skin. And as soon as you would see that, you would neutralize it. And this would be the day they decided they'd come straight from the hairdressers, so that the hair was all lovely, or they'd worn their best top to come and see you. And you'd be neutralizing, you'd be spraying it all over their face, it'd be going in their hair, it'd be going on the clothes, and it was just such a messy procedure. And once you'd made sure that it wasn't burning anymore, you'd then have to spend the next sort of 10-15 minutes applying sort of thermal waters, lotions and potions to make sure the skin felt nice and cooled, and then you'd apply their SPF, send them on the merry way. And after a few days, their face would fall off, and you wouldn't see them again, unless they were suffering from, you know, really specific skin conditions such as acne or pigmentation. Most of the people who I ever did a TCA peel never came back to me, because literally they were like, oh my God, Sarah, I can't have that again. I was walking around the office and my face was just falling off. It's a bit like the Mrs. Doubtfire when, you know, she's got the cream on her face and it plops into the tea. A lot of people didn't really like that look, and it didn't really go down well in the office. And we don't get that with the BioRePeel, which is why it's so amazing as a peel on the market today. Because even with the level of penetration, as we can see here, even though it's a 35% TCA peel, the peel is really well tolerated, and this is down to the biphasic technology, and we don't get any frosting, we don't get any keratocoagulation. And most people who have this peel will always say it tingles, and I will say on a scale of 1 to 10, 10 being tingliest, 1 being no tingle, where does it sit? And most people will say to you it's a 2 or 3, whereas TCA peels of old, people were like, no, this is like off the chart, get it off my face. we don't get that with this peel, which is really exciting. So one of the reasons that TCA is such an interesting ingredient is because when it's applied to the skin, obviously it causes this chemical injury. So when we have any kind of injury, your skin cells start to talk to each other. They've got like a little language of love going on, and it activates this complex biochemical cascade. So immediately when the TCA Peels of Old, not BioRePeel, applied to the skin, you'll find the response of the skin is, oh my God, what has happened to me? I've been injured, I need to repair. So the response of the skin is to start immediately producing growth factors. And growth factors have been shown in clinical studies to stimulate the production of collagen and decreasing the appearance of wrinkles. I've just got a little question. Let me just find. I had a case when client never had any peeling from any kind of peel, but after this one, she peeled properly. I was expecting only slightly faking whites like that. Sandra, we will address that at the end, if that's okay, because I get a little bit sidetracked, so I hope that's okay. In typical peels I've mentioned before, you know, we get the skin goes red, we get erythema, it goes tight, it feels sore. However, because we've got this biphasic technology protecting the hydrolipidic film, the skin's barrier remains intact. We don't get any keratolytic coagulation, no frosting, and most people will walk out of the door and, you know, their skin will look tighter, fresher, healthier. It's glowing. Usually this lasts for about 2 to 3 days, and then commonly if I have peels, I get a little bit of shedding, but my skin is not, you know, coming off in sheets. It's not doing that, and I don't know anybody that has happened to, but this is why I love it as a peel, because it is so safe. And you know, it's very rare for us to have any kind of you know, a bad reaction to the peel. Having said that, you know, you can never say never, but as far as I'm aware, you know, most people who've had this peel have loved the improvement that they've seen in the skin. Okay, so carrying on to lactobionic acid. So this product is made of a molecule of gluconic acid. This is a polyhydroxy acid linked to a carbohydrate galactose. So that shows you on the right. So it's an effective epidermal anti-aging molecule. It stimulates the dermal matrix synthesis and dermal synthesis. It's a larger molecule than glycolic acid, so it's much more tolerated. It will not penetrate the skin, meaning it's less irritating to the skin. It reduces our cutaneous MMPs, as explained earlier, the enzymes that are activated by UV exposure and contribute to the breakdown of collagen. So it also helps to protect from chronoaging and photoaging. And galactose is an endogen that's used by fibroblasts to produce glucosaminoglycans. So basically attracts water and plumps the skin. And lactobionic acid is a strong humectant, and for me, one of the most interesting ways that lactobionic acid is used is for organ donation, because of its strong moisturising properties and preserving properties. And literally, if you were to give me your kidney, which would be very kind, I don't need it at the moment, but if I did, it would be taken out of your body, it'd be bathed in lactobionic acid until it comes to me as a recipient donor. So it's quite an interesting ingredient. Then we have salicylic acid. Okay, this is also from the aspirin family. So this is really, you have to be careful here that you, when you're doing your consultation, that you, if you have anybody who is allergic to aspirin, obviously they can't have the peel because salicylic acid is also from the aspirin family. But it's acne's worst enemy, and it literally is a superhero for acne and spotty prone skin. It's a beta hydroxy acid, and it's a powerful keratolytic, so it selectively cuts keratin amino acidic chain of corneocytes. So basically all that means is that it dissolves the dead skin cells or flaky skin that are clogging up pores, making the skin look dull. It removes the dirt and grime to reveal fresher, healthier skin. And with it being a beta hydroxy acid, the hydroxy acid part is separated from the acid part by 2 carbon atoms, as opposed to an alpha hydroxy acid where they're separated by 1. Okay, so what does this mean? It basically means it's much more oil soluble, so it penetrates into the pores of the skin, and because it's got its bacteriostatic qualities, it can target the P. acne bacteria, fight inflammation, fight oil production. So this peel is perfect for oily skins, helps to clear out pores and prevent outbreaks. And people say to me, you know, oh, what can the BioRePeel, you know, treat? But it literally, it works on everything. It works on sun damage, it works on pigmentation, it works on oily skins, it works on aging skins, it works on dull skin. It's a peel that does, it's one peel does all that, you know. It's a bit like Sif, you know, one squirt does plenty. Or is it plenty? I'm not sure. I don't know what I'm talking about. It's not, but basically what I'm trying to say is it a peel that can treat lots of different skin indications. So you don't have to have this peel for that, this peel for that, that peel for this. You know, it's one that treats everybody. Okay, so we've got tartaric acid. This is like dicarboxylic acid and a powerful antioxidant molecule, and it's famous for its lightening and exfoliating properties. So the ancient Greeks used to chop open a grape and rub it on the skin. Me personally, I like to pop open a bottle and pop it in the glass and drink it. I'd rather drink mine than rub it on my skin. But like I said, I'm on dry January. I can only dream. But it's an acid that's famously found in grapes, and it's known for its antioxidant properties. And also in particular for its keratolytic action and its ability to reduce corneocyte adhesion, meaning that it's great for dry, inelastic skin, acne and blackheads. Then we have our citric acid. This is a tricarboxylic acid, and it has chelating properties. So what on earth do I mean by chelating properties? So basically, if you're old enough like me to remember Pac-Man, basically it helps to eliminate impurities from free radicals. So it acts as the skin's Pac-Man, chomping up all the baddies and stopping them from entering the skin. It's also good for exfoliation, as with it having keratolytic properties, causes the outer layer of the skin to loosen and shed. And it's an acid that's great to treat acne, enlarged pores, and also if you've got anybody who's got the little white bumps on the tops of the arms, so this is also known as keratosis, you can also use this peel because it's fantastic at treating these areas. Plus, it also has regenerating and tightening effect on enlarged pores. So obviously with pores, you cannot get rid of pores, but if you've got large pores, you can help to reduce the appearance and help to tighten them. Okay, so just to recap, we've got 9 actions of our peel. In the blue layer, in our lipophilic phase, the fatty layer that protects the hydrophilic phase and prevents it from oxidizing. We get a protective and stabilizing action. We have a filming and veiculating action. We have a regenerating action and a moisturizing action. So basically, when we remove this peel, your skin feels amazing. Then in our hydrophilic phase, which is our yellow layer, we've got all that amazing ingredients. So we're going to get biostimulating, revitalizing, peeling, anti-wrinkle, antioxidant actions, anti-acne. So we're going to remove cells of the stratum corneum. We're going to break down those corneocytes adhesion bonds, revealing healthier, fresher skin. We're going to have increased cellular turnover. So we're going to get more collagen, elastin, hyaluronic acid. We're going to get firmer, plumper skin. We've got our anti-wrinkle ingredients, so we're going to help to reduce fine lines. We're going to help to tighten the skin, neutralize any free radicals, and we're going to help battle against acne, eliminate comedones, and have a tightening effect on enlarged pores. So what is not to love about this peel? Okay, so I've got a very short video here. If I can ask that you don't take any pictures, because I haven't got consent of the person, it's just purely for my webinar purposes, but it just gives you a small snippet of how to apply the peel, and basically just it's a bit of a demonstration for you really. So here we go. So our equipment needed. We've got our peel, our needle to apply, we've got nitrile gloves and a syringe. So we need to clean the face. So we're cleaning the face with a nice cleanser. We've got BioRePeel. I apply it just by little tiny droplets to the skin. You will see them in Europe doing this a little bit different, and I'll explain that in the presentation. I tend to use just little tiny droplets in my syringe, apply it to the skin, and if I've got any left over, I put it in the palms of my hands and then work it into the skin. So we're just massaging it in, and we usually apply about up to 2 ml of product to the skin. If you apply more than that, you're just wasting the product basically. If you notice around the lips, we've got some Vaseline as well, just to protect that mucous membrane. We massage it into the skin. It takes a couple of minutes until it's tacky. And you'll know it's tacky because when we come to feel it with our gloves stick to it. Okay, so you can see it's sticking. We'll leave it on to 3 to 5 minutes. So you can see that nice yellow haze on the skin. Remove with water-soaked gauze or cotton pads. You can use a thermal water or just water, cool water I think is nice. If we've got oily skins, then I'd apply a Byrie Hydra, which I'll talk about as we go through. And if we've got drier skins, older skins, then I would go for the BioRePeel. It's more of a cream. And then I'd apply SPF, and it's just as simple as that. Okay, so this is what's in our face, neck, and décolleté. It's a 6 ml vial containing 35% TCA. We've got 5% Lactobionic Acid, 2% Salicylic, 10% Tartaric. We've got our amino acids, which is our glycine, our proline, our hydroxyproline, and an arginine. We've got vitamins, vitamin C, vitamin B2. We've got our lifting active principle, which is GABA, which is gamma-aminobutyric acid. We've got our lipophilic phase, which is not spelled as it should be, but we've got containing our squalene and our isopropyl myrostate. And our pH is around -1. And it comes in a box of 5 vials, so 6 ml, 5 ml vials. As the name suggests, FND, face, neck, décolleté. Like I said, up to 2 ml on the face. It's common sense, really. If you've got somebody with a small face, you'd apply less. If you have someone with a larger face, you'd apply a little bit more. If you want to incorporate the neck, then I would highly suggest you do, because you'll find that neck and hands do give the game away. They give the age of a person away. And then if you've got anybody who's really particularly sun damaged on the chest, you can also incorporate this area. But be mindful of the price, because, you know, if you're going to treat different areas, you're going to use more products. So do price accordingly for this. Your protocol is applied every 7 to 12 days, every 1 to 2 weeks. You can do it as a course of 4 to 6. Usually, most people do a course of 4, and then you'll find for maintenance, clients come in once a month to have it done. So these are our results, which I just love, and I can imagine this young lady is absolutely ecstatic with these results. Now, you can use the BioRePeel in conjunction with other treatment modalities. What I will say to you is, when I first started using the peel, I used it just literally on its own for months and months and months. I didn't use it with any other treatment modalities. But as soon as I knew the capabilities and I know what reaction happened to my skin, and I was confident that it was a great peel, then I started using it with dermaplaning. Now, if you do use dermaplane, you would dermaplane before and apply the peel afterwards. This will sting. Okay, this will feel a bit tingly, bit more than a 2 or 3. It's more like a 7 or an 8, but it's very, very sort of minuscule amount of minutes that would happen for. It's usually about a minute. It feels a bit uncomfortable, and then it literally, your FND can be kept on the skin for a maximum of 5 minutes, and after this, the buffering system of the skin deactivates the formula, so it's self-neutralizing, and it'll have no more action on the skin, but it will feel more keen. I always say cheeky, feels a bit more cheeky if you are dermaplaning. There is also a protocol for microneedling. So this young lady would benefit, I feel, with she's obviously had 4 sessions for treatments a week to 10 days apart. And then literally I would then start a course of microneedling and probably put a peel once a month in that protocol. Again, tone, texture. This lady, you know, the improvement of the tone and the texture and how much it's glowing after having 3 treatments of BioRePeel is, I think the results speak for themselves. Now, I'm always mindful and wary about treating pigmentation or melasma because, you know, patients and clients have to realise that they have to keep up with a good skincare routine, and they have to keep up with regular maintenance of peels to maintain these results. You know, it's no good having a course and then, you know, just going back to their normal routine and sticking the face in the sun. You know, that's going to come back. So if they're dedicated to the cause and they want to really reduce the appearance and have results like this lady, they have to be compliant. Again, really nice results here. Fresher, healthier looking skin, less congested, brighter, not as dull. Again, like I said, you can always tell the age of a neck. So, you know, still a lovely result just with a peel, which is pretty astounding. Again, you know, same again. And also you can do a bit of micro needling on the necks, and same with this decolletage here. So like we said, the normal protocol is 4 treatments, 7 to 10 days apart. You can repeat the 4 sessions after 3 months, or literally you can do this once a month. I mean, I love the BioRePeel. I just use it whenever I feel like my skin looks dull. So probably every 2 or 3 weeks, I try and use a BioRePeel. But as I've said, this is how we activate it. We just shake it to wake it. We mix the 2 phases together, and we get this greeny sort of, I'm an ex-recovery nurse, so it almost looks like a bit of a Pseudomonas phlegm to me when it's all mixed up. So it's like a real nice greeny colour. It will have a slight eggy smell to it as well, bit of a sulfur smell to it. That's completely normal. So don't worry that the peel has gone off, because it hasn't. That is completely normal. We're going to talk about some creams, but before we do, I'm going to just come back on the screen and just talk to you about how we apply the BioRePeel. So I always use, I haven't got a 2 ml for some strange reason, but I've got a 5 ml syringe, but 2 ml syringe is, you know, of choice. And I always use a yellow, sorry, not a yellow, a pink 18 gauge needle. I don't know whether you can see this, but it's got a really large bore on the end. And that's because this product is quite gloopy. So when we activate it and shake it to wake it, so we're shaking it to wake it, we've got a nice green colour. We literally will just draw off what we need. I'm not going to draw off much because I'm only going to do it on the back of the hand. So for me, in Europe, you'll see some Europeans, they will apply it with, so if you can see that, with the needle, which does give you control. However, if somebody came towards my face with this needle, I'd feel a little bit intimidated and a little bit scared. And you don't want to be sneezing if you're using that needle and stabbing someone in the face with that, because that wouldn't be very nice at all. But literally, if I don't know if you can see this, you can just literally, you need the lightest amount of pressure, she says, and literally you just apply it to the skin, which is as easy as that. We rub it in. You see, if you ever meet me in person, you must ask to look at my hands, because my left hand is always my BioRePeel demo model. So it's incredible. You can't ever see it on the webinars, but if you meet me in person, just look, you'll say, Sarah, let me look at your hands. So my left hand looks like it's 25 years old. It's amazing. It's really plump. There's no sun damage. There's no age spots. It looks really glowy. It's really healthy. It's really soft. So we just rub that in. If you should be wearing gloves, so latex gloves, not powder gloves, because the TCA will burn through the powder. But kind of, if you can hear that, so it's gone sticky. Okay, so you can't, I don't think you can see it on the webinar, which is a shame. But literally, I've got age spots on this hand. My skin is a lot thinner, and a lot more. It looks a lot more dehydrated. On this hand, I've got no pigmentation, no age spots. You really can't see my veins as clearly. Actually, you can see that. You know, it's a lot brighter, and my veins really stick out on my 42-year-old hand as opposed to my 25-year-old hand. That's what I always say. So please ask for me to show you them when, if you ever see me in person, if COVID allows us. So we leave this on for up to 5 minutes. If it's somebody's first time, then I'd always go for just bear on the side of caution and go for the 3 minutes. Like I said, if you are going to even think about using this, buy the box for yourself. This is the box. It comes with 5. We've got 2 out. I've used 1 for all my other demos, but literally we usually have 5 vials in here, and they've got 6 ml of product in there. So that's enough for 3 peels or 3 clients on the same day, because you can use them on different clients, because we're not doing any cross contaminations. That's absolutely fine. And basically, when we have removed, I mean, I haven't got water, but we'll remove it anyway with our cotton wool. So you remove it with your cotton wool, with water or your gauze, and then you'll see that it's all yellow. So literally, remove it with the water until you've got your cotton pad or your gauzes clean, and then we apply our lotions and potions. Now what's great about this, we have a salon size, so we have the professional size, which is 200 ml, which is brilliant for you to use in clinic, and then we also have the consumer size, which is 100 ml. 30 ml, I lied, 30 ml. And basically, I know what it's like when, you know, clients are and ahhing whether they should buy the products, but it's not going to be great if they use other products, because we don't know what kind of reactions they may have. So I always say, if you are having a peel, then you use products that are within the same family, because families, what do? They work together, they look after each other, okay? They're made from the same blood, okay? So literally same family. That is from the BioRePeel. We've got Byrie Hydra. So I would use this, literally all you need with Byrie Hydra is hardly anything. Oh, I don't want to do this just in case it goes anywhere. I might use the smaller one. Let's see. Here it comes. So literally, it's the tiniest amount that is needed, and a tiny amount, as you can see, goes a long way. Okay. So this will last them a long time. This is mainly, the Byrie Hydra is mainly for oily skins. It's more of a serum. It's moisturizing. We've got over 15 active ingredients in the Byrie Hydra. It protects against UV damage. It stimulates skin metabolism. It has a soothing action on the skin, stimulates the healing process, and it improves the integrity of the skin. And I have got a lady, I don't think she's on tonight actually. Oh, it might be. I think it is Rue. There's somebody, I think it is Rue. There's a lady on here tonight that did the peels without using the creams. And then she did another course with using the creams and found she got better results. And that's because we've got lots of different ingredients there, 15 active ingredients. We've got ingredients from the 3 oceans. We've got extracts from the Pacific, the Atlantic, the Indian Ocean. So they're really great for dry, tired, mature skins. But like I said, we can use these in the morning or the evening, or both. I mean, I would always say morning and evening anyway. And they don't have to just use it just because they've had a peel. They can carry on using this long after having their peel. Then we have our BioReLift. So again, it comes in a salon size, and we have our consumer size here as well. This, I would say, perfect for the maturer, older skins. So again, tiniest amount needed. You don't need a lot of these products. So again, really lovely creamy texture, both really absorbed very easily into the skin, and they contain the tiniest particle of hyaluronic acid, which is able to penetrate deep into the skin. And this is why we get this beautiful sort of feel to the skin and hydration to the skin instantly. And there's over 20 active ingredients in the BioReLift. And basically it's rich. We've got our almond oil, we've got shea butter, we've got bisorbitol, and they're calming, soothing, anti-redness, helps with any irritated or damaged skin. Like I said, moisturizing, really great for our drier, older skins, in my opinion. Again, you don't have to have BioRePeel to use it, but you know, if you're using it in conjunction with the peel, you will see better results. And like I said, if you are going to be using this yourself in lockdown, it's the perfect opportunity to be talking about the peel. You can do a little diary, you can talk about the creams. You could even, if you were thinking about doing some little care packages, maybe you can send some little care packages out to your clients. You can put these in a little tiny pot and give them a little sample before they even, you know, try before they buy. Send them some little calming tea bags. You know, you can make a nice little package and send them out a little care package of any new treatments that you might be trialing, or you know, you'll bring into your clinic after lockdown. And like I said, if you buy in, this is such a great size, the 200 ml, because a little goes a long way and it will last you a long time. Okay, So who can use BioLift and Byrie Hydra? Every age, every kind of skin, every skin type. And that's another reason why I absolutely love BioRePeel. We don't have to worry about treating Fitzpatrick's 1 or 6. It's suitable for all Fitzpatrick skin types. We don't need any needles apart from when we're prelating the product. We don't get any frosting. It's painless. It's fast. We get an immediate result. We don't get post-treatment scars. It's multifunctional. We don't get any oxidation of the product. We don't need to put it in the fridge. It's for ages 18 and above. You will have to check on insurance. You will probably not be insured to treat anybody under 18. It's for every season. You don't just have to have this in the winter. You don't just have to have this while we're in lockdown. They can have this in normal life when we get back to a normal life. We don't get any photosensitivity. It doesn't contain any ammonia. And we can use it, as I've said, with other treatments. So you'd use it before photostimulation, after radiofrequency. And if you're doing any topical treatment, such as a toxin or a filler, then you would use this product, BioRePeel, before. And you can use BioRePeel in synergy with other treatment modalities to improve the performance and the result. So I think that is about everything that you need to know. You can visit shopbeautiful.co.uk to set up an account. There's the prices are all in the website. So if you haven't signed up for an account yet, get yourself signed up. I think there's some discounts to be had. I'm just going to go to stop my share and come back to me. So hello again, and go to my questions. So, okay, let me just answer Sandra's. I had a case when a client never had any skin peeling from any kind of peel, but after this one, she peeled properly while I was expecting only flaking. Why is that? Sandra, was she using any retinols? That's another thing I need to talk about, is your contraindications. They're not on here, are they, tonight? So your contraindications, anybody who is pregnant or breastfeeding, you would not use the peel on anybody who's pregnant or breastfeeding, anybody with diabetes, anybody with autoimmune disease. And what's interesting about autoimmune diseases is that 80% of people that suffer with an autoimmune disease are women. Which is our main, predominant client and patient that do come in to see us are women. But if it's usually down to the medication. If they're well controlled, there's no reason why they can't have the BioRePeel. You would just need to check with their GP. Same if they're diabetic type 1, no. Diabetic type 2, yes, if they are well controlled. If anybody has got any active skin cancer or any lesions that you're not sure about, then I wouldn't obviously start putting BioRePeel on there. Also, anybody with acne, psoriasis, eczema, any kind of skin condition like that, it's a no. I'm a nurse, I am not a dermatologist, and I will only work within my code of conduct. So if I don't feel comfortable treating somebody because I'm not sure if they've got any kind of lesion that I'm not sure about, I won't do it. I like to sleep at night. I like my sleep. But anybody also, if they're using Roaccutane, they would need to stop using this for 6 months prior to using the peel. And anybody who is on a retinol, you would advise them to stop using their retinol probably 7 to 10 days before the peel. And I wouldn't commence using the retinol until they finish that course. So I'm just wondering, Sandra, was she using a retinol? So if you can answer there, let me just find Sandra again. I'm trying to find Sandra again because I've lost her. If the client still not want to buy, can they use theirs, and can they use any BHA cleanser if age concerned skin? Online training showed to use both after peel products, first Hydra then Lift. Did I misunderstood? Do you know what? You can use both. There's no reason why you can't use both creams, but I would say cost wise, I would say if you've got somebody with oily skin, you would stick with your Byrie Hydra. If you've got someone with dry skin, I would use the Byrie Lift. The reason in the training video I used the serum and the cream was to show you one's a serum and one's a cream. So I hope that helps to clear that up. But there's no reason why you can't. There's no reason why you can't just buy the salon size and decant it into a little pot, because cost is an issue for a lot of people, and they want to see the results, and they want to know that they're buying great products. And that is always another reason why I always say it's so important for you to use the products, because if you're using the products and people are saying, oh my God, your skin is amazing. It's really glowy. It looks really healthy. What are you using? And you say, oh, well, I've been having BioRePeels. I've been using this cream. How many people want to know, your secret? Will have it. It's very much a case of you can talk from your own experience. From my own experience, like I said, I've been involved with this peel. Sometimes I peel, sometimes I don't. If I do microneedling and a peel, I will absolutely peel, but not to the fact where my face is falling off. It's more like a dry skin, and it lasts a couple of days, and I tend to dermaplane it off, actually, if I'm honest. Let's have a look. What would the recommended cost peel client? This peel will work out around about £15 per peel. Most people, it depends where you are in the country, but demographically, it will usually work out as £60 to £90 that people charge per peel. Obviously, if you are wanting to do a bit of a COVID deal when you go back and you're talking about this amazing product and you want to do an introductory offer, I'd never give away anything for free. But what I would say is, you could do 4 peels for the price of 3, or you can do 4 peels and you can throw in a cream for them as well. So they've got the whole package. It's up to you how you want to do it. I'm not here to teach you business advice, but if it was me, I'd want them to get the best results. So I'd probably put the cream in as a little bit of a freebie with the peel package. So photostimulation is that LED light. It means they should first. So you can use photostimulation. Let me just LED light. Sorry. So you can do the peel first and then the LED light. So if you were using BioRePeel first, then you can pop them under the LED light. So you'd use the blue light for acne, and you'd use the red light if the skin looks a little bit red, or just for general wound healing. If that makes sense. Hope that makes sense. So when used alongside microneedling, there is a protocol for this, Elizabeth. And like I said, I wouldn't jump straight in to do microneedling straight away. Like I said, I use this product for a good 6 months, probably even 8 months on its own, without using it with anything else other than the peel on its own, and still had fantastic results. But if you are treating somebody who has got sort of spotty, acne prone skin, and they've got a bit of scarring as well and a bit of PIH, I would get the acne and the spotty skin under control first, and then I'd start a course of microneedling with BioRePeel. But there is specific protocols for this. So you used a ml on face and still got flaking, but recommendation is 1.5 to 2 ml. If I use less, hang on a minute, but cover all face, does that mean it works less or no? It's just a case, Sandra, of, me personally, I use about 1. I've got a small little face. My kids say I've got like a pea head. Thanks, kids. So I tend to use about 1 ml to 1.5 ml on my face. Anything extra, I put it on my neck. But if you've got a larger face, then you'd need more product. If you want to use it on your neck, you'd use more product. It doesn't make a real difference to how much you put on, Sandra. It's a case of you need to make sure that you're rubbing it in until it goes tacky, and then you start your countdown. So you may have thought, you might be a bit like me and thought, oh, I'll just leave it on for 5 minutes. Just do it gradually. Start with the 3 minutes and then work it gradually up to the 5 minutes. That's what I would personally do. So I'm just going to see if there's any more questions. If, like I said, ladies, if you would like a picture to go on your Instagram as well, so you can put it in your story, if I hold these up and just pose for a little picture, then you can put these as a picture to talk about to your patients and clients about a new product that you've been watching and learning about this evening. My Instagram is sarahwhitehead.official, or you can tag Shop Beautiful in as well. I'm sure they'd really like that. So we've got I'll take a picture if you want to take a picture. I feel really silly when I have to do this. So if you want to tag me on your Instagram stories, that would be absolutely brilliant. You're more than welcome to do that. If you've got any questions that you don't think of now, but a few days after, you think, oh, I never asked Sarah that question, just message me or message the guys at Shop Beautiful. We've got our creams here. So if I do our little, there we go. If we've got the Byrie Hydra and the Byrie Lift, you can take a picture of this too, a little screenshot. I have to pose, because if I don't pose, it looks like I've got no teeth, and I'm not joking. It's not a good look for me. So I'm just going to double check there is any more questions. Let me have a look. You're all very quiet this evening. I think everybody's on. So I hope, actually, let me just check the time. So yeah, we've gone about 4 minutes over, but I hope you've enjoyed the webinar. I hope you feel like you've learned something. If there's anything that you're not sure of, or you want to know a little bit more, then please just message myself. If you want to find out about more products, about the services that Shop Beautiful offers, then please follow them on Instagram. Also follow me, because it's always nice to have a follow. Anybody who follows me, I will always follow back. And please tag me on your Instagram stories. Can you use info on our pages that is on training? I'm not sure what you mean, Sandra. If you can elaborate, that'd be great. So hopefully you've really enjoyed it this evening. I love doing my webinars. I love training people. It's always better for me when I can see people in person. I'm really missing seeing people in person. I don't know about anybody else, but I'm really looking forward to the day when I can get back into hands-on training and meet people in the flesh and not feel like I'm talking to myself. Is there online training on page and information that we can provide? Yes, Sandra, there will be. If you have any issues, Sandra, just drop me a message and I'll endeavour to get that sorted for you. Okay. So hopefully you feel like your hour has been well spent. Oh, how do I store the rest of the vial once opened? Literally put it in the cupboard. Okay, it'll last about 6 weeks, sorry. There's a 12-month expiry date on these, so I think these are due to expire. I don't know when they're due to expire. Let me have a look at one of them. So this is actually 2023. Okay. So as long as you are keeping storing the box upright, don't lie them down, make sure they're upright in the cupboard. But as soon as you've opened a vial, it needs to be used in 6 weeks, within 6 weeks. But like I said, if you are doing this peel for yourself in lockdown, I would do absolutely 100%. If you're going to bring it into clinic, I would 100% do a little video blog on your Instagram stories. You know, you can really push this. You can talk about the creams as well. You're more than welcome to tag me in anything BioRePeel related, and I will repost it and reshare it for you as well. But yeah, just take your clients on the journey with you, and talk about whether your skin peels, whether it doesn't, whether it's dry skin, how your skin looks afterwards, what it feels like when you apply it. The more information that you drip feed to your clients in lockdown about this fantastic new peel, the more they'll be eager and excited to try it, because it's taken the aesthetic industry by storm. It is literally an amazing product. It's suitable for all different skin types, and it covers a multitude of skin indications, and also the fact that you can use it on all Fitzpatrick skin types is another amazing revelation for the peel. And if you tag me, Sandra, all you need to do is just tag me, just put @sarahwhitehead.official. I wanted just Sarah Whitehead, but somebody already had that one, so I had to make it a little bit different. So I hope everybody has found that useful and enjoyed it. Tonight we've gone along with no technical errors, which is always a bonus, because there's always usually something that happens, but tonight it's gone right nice and smoothly. So thank you all for joining me from wherever you have all joined me from. It's been an absolute pleasure to virtually connect with you all and give you the information on a lightening, brightening, tightening peel, minimal prep, minimal pain, minimal downtime, but with maximum results. And I look forward to being tagged in all your posts and seeing and hearing about your results. So have a great evening, everybody. Go and grab yourself another glass of wine. I'm going to have a chamomile tea. I know. It's good for me. I have to keep telling myself it's good for me, helps me sleep, and hopefully we shall meet in the flesh one day in the very near future.